My name is Dr. Sanjay Patel, and I'm a consultant based at Southampton Children's Hospital, and I specialise in looking after children with severe infections or immune problems. Over the past 9 months, we've all been completely preoccupied with thinking about coronavirus, but at this time of year, it's really important to think about the other infections that normally circulate, and one of the most important ones of those is influenza, flu. As you know, we've got a highly effective vaccine against flu, and in this country, all children aged between 2 and 11, which is the first year of secondary school, routinely get the vaccine. It's really important they do get it because although most children don't get that sick with flu, they're regarded as super spreaders, which means that even if they have mild infection, they may transmit it to loved ones, to grandparents, to parents who have other medical problems, and they could get very unwell with flu. If your child's at school, it's likely that they're going to get the vaccine through their school, but if they're younger than reception year, you should arrange for them to have it via your general practitioner. Unfortunately, pharmacists are not able to give the flu vaccine to children. However, if your child's outside of those age ranges, there are still lots of children that would benefit from having the flu vaccine, and that's because some children with other health conditions such as breathing problems, including asthma, heart problems, kidney problems, liver problems, neurological problems, weakened immune systems, even diabetes, if they get flu, they're likely to get much more unwell than children without those conditions, and they're likely to end up in hospital potentially. So I'd really urge for you to arrange for your child to go to their general practitioner if they're outside of those age ranges. If you've got any questions about the safety of the intranasal flu vaccine, that's the one that goes up the nose. You have a look at the Healthier Together website. There's lots of excellent information on there, or speak to your health visitor or your school nurse. But most importantly, be prepared for this winter. If your child has symptoms or gets flu, the symptoms are the same as those with coronavirus, and it will mean that your child will be excluded from school until they get a test result back. And that can prove challenging for your child in terms of missing essential education, not seeing their friends, and for parents because they'll have to isolate and not go back to work until we have a negative result on that child. Thank you.